The healthcare industry has significant potential for high earning potential. But did you know that over 90% of doctors actually rely on insurance dollars for their revenue? Yet annually, over $200 billion in medical claims are initially denied. The top two reasons for those denials are missing information and claims being sent to the incorrect payer. And unfortunately, a third of those claims are never reworked and resubmitted, resulting in a write-off, meaning that the doctor is never compensated for the services that they rendered. The reasons for those issues are erroneous data entry, receptionists failing to collect all pertinent data, as well as identify the correct insurance company that is responsible for the patient. And the root of these issues is simply that a receptionist is an entry-level position and oftentimes does not require any prior billing or insurance knowledge. Our solution is to ditch the clipboard, and I mean ditch the physical clipboard as well as the digitized clipboard. With registration automation, we offer our clients advanced OCR technology that will scrub all pertinent data directly from the insurance card and directly from the identification card and map it directly into the doctor's billing system. That data is then analyzed and aggregated with our business logic to identify any missing information and request it in real time directly from the patient. And overall, this really just does give patients an improved registration experience. Now, I'll be honest with you. In my experience, doctors don't care much about what happens to the patients before they enter the exam room. I want to share a quick story about taking my daughter to the NBA clinic in Clinton, Mississippi. And so she was there for physical to play basketball, and I observed a gentleman come in that was wanting to get a blood pressure check. And as soon as that receptionist handed him that clipboard, he became absolutely unglued. I mean, I could hear him saying that he had just been there, that why does he have to do this again? I could hear the receptionist defending herself, saying, listen, this is protocol, we have to collect this information at every visit. And the only thing I can think was, his blood pressure is definitely going to be elevated. But I shared that story to say that yes, it's really not on the doctor's radar now, but I do think that we will see doctors begin to care more and more about that lobby experience in the future. And so technology is not new in healthcare. Back in 2009, the government issued a mandate requiring certain specialties to use electronic health record systems. And man, did the floodgates open. We started seeing all type of technology pour into the healthcare industry. And not just to support the doctor, but also to support the business tasks, the administrative side of healthcare. So we are not reinventing the wheel, but we are creating a much smoother ride. Registration automation does two things that I am extremely proud of. The first is that it will register a patient completely and accurately without staff intervention. And the second is that our business logic will identify and request in real time missing pertinent data directly from the patient in the application. And this is extremely important because once you leave the doctor's office, you've gotten your services, you may have even gotten a few samples. We're back at the office crossing our hands, fingers, and toes that we're going to get compensated for the services that you just received. Look, many people don't know that several pieces have to fit together perfectly like a puzzle to make sure that doctors are actually paid. And registration automation is a big, big part of that puzzle. And so it makes the solution really beneficial for all providers that are in that 90% that I spoke about on the first slide that depend on these insurance dollars for their revenue. And so it doesn't matter if it's your favorite family practitioner around the corner or if it's one of the huge hospital systems like Baptist Medical Center. But our target market is practice management systems. And we have a very good reason why. The doctors are already there. Doctors have already bought into practice management systems to the tune of $10.89 billion spent in 2023, and that number is consistently going up year to year. This includes your handy-dandy appointment reminders, and it also includes those quick pay links. This is the category that registration automation falls in. Also, by marketing this way, it allows us to use a good bit of strategy. When we know what practice management system you use, we can tell a lot about that client. The size of the practice, their internal workflow, and most importantly, what kind of money they have to spend on a system like this or any technology for that matter. Also, marketing by way of the practice management systems gives us a warm introduction to their users. They have already been received, accepted, and trusted by those users. And speaking of that, just last month, we secured our first software partnership with Open Practice Solutions, which is an amazing experience for us and also an amazing opportunity. This is a company that we love the software, and we love the idea of being able to work with them. And what makes the deal just a little sweeter is the fact that they declined on Freezio, which is one of the leading patient registration technology options out there. And so we didn't just get here by happenstance. We have done a lot of work to get to this point. Back in 2021 is when the software was initially designed. In 2023 is when the initial MVP was built. A couple of months after, in May 2024, we were able to bring on 2 beta users. But then in October, we identified a necessary API upgrade. Also, at that time, we made the decision to switch from a native app to a web app, which has been wonderful. And then just a few weeks after that, we were able to sign on 2 paying users right from King's Daughter in Brookhaven, Mississippi. We have solidified an amazing opportunity with Open Practice Solutions that gives us access to 53,000 users. And this is where we are now. Our next step is to aggressively market and then also hire back-end developers to build those additional partnerships with other practice management systems, and then also a full sales team. And so if you notice, yes, I talk a lot about marketing, and I did use the word aggressive. And that's because, again, Open Practice Solutions is an amazing opportunity for us. Again, I spoke about a warm introduction to 53,000 users. We plan to market until it hurts. We're not going to leave any stone unturned. But if you notice from my graph here, Open Practice is a drop in the bucket to the potential market that is out there. It is literally one of 600 EHR and practice management systems that we can connect with to improve doctors' and clients' registration process. And so to the money slide, it's real clear. There's just 3 big spots here. We intend to spend most of our money in technical and also in marketing. So we are seeking a $400K investment to do just that. We want to aggressively go after that Open Practice Solutions opportunity. We want to meet and greet every one of the 53,000 users that they currently have, but we also want to simultaneously go after, investigate, and potentially build API connections to those additional software companies that are out there. Okay, and so I would be remiss not to talk about the team that has got us to this point. I'm Melissa Bloom, I'm the founder. I have worked in the healthcare revenue industry for over 20 decades, over 2 decades. I own a medical billing business, and I have trained more medical billers, receptionists than I even want to talk about. I am well versed in all things revenue healthcare. Next is Dr. Nashley Cephas. She's our technical advisor, and she has been instrumental in helping me understand those so complex technical concepts. Kata Walker is our RHIT compliance officer. She ensures that every single tool that we use and workflow is HIPAA compliant. Matthew is our amazing engineer. He is the one that's responsible for the API upgrade, and he's also responsible for converting us over to the web app. He is actually the back-end developer that I'd like to bring on full-time. Next, we have Marvin Smith, who is my product manager, my project manager, and my right-hand man. He makes sure that everything gets done correctly and in a timely manner. And then Brandon and Chris were responsible for the original MVP as well as user interfaces. So I just want to conclude with a few things. I didn't just wake up one morning and say I'd like to put something in the tech space. This solution is truly built from years of working in their back office, helping doctors get their revenue. We have a partnership with Open Practice Solutions that offers us access to 53,000 users. We have 2 signed paying customers, again, right out of King's Daughters in Brookhaven, Mississippi. And also this software is built to scale fast, not just per provider, but also for additional practice management systems that we intend to seek out. So I want to end it there with a big thank you and answer any questions you may have. Yes, sir.
Sales strategy with this? Is it going to be direct sales? You're going to work through value-added resellers? Because there a lot of those already have practice management software that they would put in.
Yes, sir. So the question was, the question, I won't give a broad, is how do we intend to market? So we have a couple of things that we're going to do. Direct marketing is definitely one of them. We plan to do a lot of print marketing in the physician journals, but also another reason why we really wanted to work by way of the practice management systems, because they do things like put us on their websites, and also, for instance, with Open Practice Solutions, he told me they had been asking for a solution like this. And so now he has something to offer them, which is registration automation. We also intend to offer CEU hours, which is really, really popular in our industry because everybody has to have them, and they will listen to you sell anything for an hour just to get those CEU hours. So those are the marketing options we're considering right now, or we're doing right now. Any other questions? Yes, sir.
When you're signing in, many insurance companies have different insurance companies, particularly United Health.
Yes.
And you have providers that are supposed to be in United Healthcare, but they're not in the right United Healthcare. Does your product identify this quickly and say this provider is not qualified in this plan?
Absolutely. So I want to answer that question in two parts. So part of our business logic is, because you're absolutely right, United Healthcare is known as one thing but can have 5 lines of business. Medicare can be known as one thing and have 5 lines of business because of the new Advantage plans. So part of our business logic that we're really proud of, which also helps us to accurately register patients, is yes, it does identify the correct plan. And then the second part of that question is, if the provider does not take those plans, the application will let them know and offer them the option to either cancel the appointment or move forward as self-pay. Yes, sir.
So your customers are different than your users, right?
Absolutely, yes, sir.
So, on the business model, can you help me understand what you're charging, what the actual business model looks like? And how does the experiences of your users and experiences of your customer, how are you balancing the different needs that you have in terms of product build out and your focus on your technology, your technology?
So, to answer the first question, so the question is about the pricing, and then also because this application does have multiple users, meaning that we have the providers who this technology is actually built for, and then we have the patients who are actually using the technology. How do we balance that? Okay, so the first answer would be, so we offer registration automation on the subscription basis because that's what we've seen that doctors like. This is how they pretty much do everything. The practice management systems and the EHRs, they pay it on the monthly basis. They're on a subscription. And then right now, with the new users that we just signed, and probably just for a little while here, we are using this as starter cost. So depending on your census, the doctor's census, and what that means to us is how many patients they see every day, every week, every month. This will determine the cost per month that the provider will pay. Now, in terms of
Is that per user or
per user. So if you go into a clinic and they have 5 different physicians and a nurse practitioner, we want $99 a month 6 times. And then, so to answer your other question regarding addressing the different users. So again, this technology is, it's very unsexy. It is built for the provider. It is built to make sure that they get their money. I'm a healthcare consultant. That's the side of the fence that I'm on. Now, again, as I mentioned too before, there has not been customarily a lot of concern about the patient experience. But I am very confident, and we have not gotten any negative feedback from patients, so far, but I am very confident that this is going to be an improved experience for them. But again, this solution is built to protect doctors' revenue. So that is literally like the main concern. Any other questions? All right, thank you so much for your time.